name is Dr. Himanshu Verma and I'm a vascular surgeon at Fortis Hospital Gurugram. And today I wish you a very good vascular health on the day of National Vascular Day. So 6th August has been celebrated as a National Vascular Disease Awareness Day throughout the country. So what does a vascular surgeon do? So basically, every organ has blood vessels, arteries and veins. Arteries are the one which bring fresh blood from the heart, and the veins are the ones which take the dirty blood, deoxygenated blood, back from that organ, and then they join together and send it back to heart. From where the deoxygenated blood goes to lungs, it gets cleaned up, and then it comes to heart for the further pumps. Okay, so just like heart, the angioplasty and bypass is a very common term in heart. But the same kind of problem, the blockages or something, ballooning or leakages, can happen into the veins and arteries of the whole body. And as a vascular surgeon, my job is, if this kind of problem happens in any part of the body except heart and brain, because there are separate teams for there, we are there to fix it. What kind of patients, what kind of symptoms I treat? So depending on every organ, the patient's presentation is different. The most common patients we have is the patients who get blockages of the leg arteries or the blockages of the veins of, leakages of the veins of leg. And in the blockages of the arteries of leg, patient can develop symptoms like pain on walking, or in the advanced stages, pain is very severe and patient can also develop gangrene. These are the patients who need angioplasty or bypass surgery. If they cannot get it done, a patient can land up with major amputation. The patients who have got leakage in veins, they come with the varicose veins. These are the bulging veins, sometimes just cause the swelling. But in some patients, it can also lead to ulcer formation. So fixing varicose vein is also one of the major job of the vascular surgeon. Apart from this, there is involvement with all of the specialties, because every specialty cater with a certain organ system, and that organ system has got arteries and veins in it. So one of the big example is nephrology. For the dialysis, a special surgery is needed called the AV fistula. And a lot of time, AV fistula is done by many surgeons, but when multiple fistulas fail, then the role of vascular surgeon comes in, specifically to salvage and help those patients where there are no visible obvious options of making fistula. So it's very important to have awareness about the vascular surgery, vascular surgeon, as well as vascular diseases, mainly because so far there has been very less vascular surgeons across the India. Most of them are limited to south. Now as the newer generation is coming up, there are more and more new vascular surgeons are coming up in north. Because of this, a lot of diseases, the patients, they keep on roaming with some or other surgeons, sometimes with medicines. And doctors, as well as even patients, they don't know whether this is actually a disease. And sometimes if they know the disease, they remain in confusion whether is there any treatment for this or not. So if you have certain kind of symptoms, which, as I said, as a few of them I mentioned out, and which needs a vascular care, you should be able to reach out to a vascular surgeon with the availability of online media, the social media, the Google platform. You should be able to find the right keywords, the vascular surgeon near me, and you should be able to reach out. So again, on this National Vascular Day, I wish you all a very happy and healthy vascular health, and take care of yourself. Thank you.